My roll number is 731. Today I will be discussing the topic the classification of the diabetic retinopathy and how it is classified and why does the classification even matter and why are we even studying it. So starting from the simple definition of the diabetic retinopathy, we will start that diabetes complication that is affecting the eyes is characterized as the diabetic retinopathy, and it is caused by the damage to the blood vessels of the retina, and even the high blood pressure can cause the blood vessels to leak out and swell or become blocked. And it is one of the leading cause of the blindness in adults, and that's the reason that we are studying the diabetic retinopathy and its classification. The second question, that why do we even classify the diabetic retinopathy? Why cannot we just say that the diabetic retinopathy is just one disease and all of the stages we can label them as diabetic retinopathy? Why are we even classifying it in broad categorization? To answer that statement, that the first thing is to guide the treatment and depends on the stage, that on which stage which treatment will be effective. The second point is that monitor the progression, that is whether it is mild, early or severe. And the third is to improve the communication, that is the standard language for the doctors. And the fourth but last but not the least is the for patient awareness, that is understanding the seriousness of the disease. And right now we will be going for the conventional clinical classification of the diabetic retinopathy. The point to be noted is that this is the conventional. Other classification of the diabetic retinopathy also exists. Right now we will be focusing on the conventional clinical classification. The first thing in the conventional clinical classification is that the background diabetic retinopathy, BDR, is the first initial stage of the diabetic retinopathy that is characterized as the group 1. Second is the pre-proliferative diabetic retinopathy, PPDR. It's the before the proliferation of the vessels. Third is the proliferative diabetic retinopathy, the stage in which the proliferation of the vessels is seen. The fourth is the diabetic maculopathy, and it's a very clinical and very severe amount of, you can say that stage that it does not, it can come at any stage. But for understanding, I have labeled it at 4 point. Number 5 is the advanced diabetic retinopathy, ADR, and the last but not the least will be the burnout diabetic retinopathy, the 6th stage. So clinically, conventional classification of the diabetic retinopathy is classified into the 6 groups, which I have summarized in this just one slide. Now, I will be discussing them one by one from the same book from which the exam is coming, Jatoi book. This is the book from the Jatoi book, and this is the background diabetic retinopathy. In this book, they have summarized the background diabetic retinopathy in just one picture, telling that the heart accident and which specific type of hemorrhages are involved. Dot plot hemorrhages, if we are focused on the lecture in the previous of the eye, you would know what is dot plot hemorrhage and what is dark plot hemorrhage. And one more point, which I have labeled it with the green pen, the microaneurysms are seen at this stage. These are the earliest signs that are seen in the diabetic retinopathy, and in the background diabetic retinopathy they are seen microaneurysms, which is one of the clinical distinctive point of this classification. I am just showing the heart exudate again here for better view. Second is the pre-proliferative diabetic retinopathy. Point to be noted is that the proliferation of the vessel has not begun yet. And again from the same book, heart exudates. And the point to be noted is that the dark plot hemorrhages are seen in this categorization of the diabetic retinopathy, not dot plot hemorrhages. And along with that, if you are focused on the lecture of the eye, there was 3 types of the curiosity of the venous changes: bleeding, sausage, or one more category was there. But the sausage dilation of veins are also seen in this one clinical picture, that is kind of summarizing all of the pre-proliferative diabetic retinopathy in just one picture. Along with that, AV shuts can also be seen. Now, moving to the third clinical conventional classification of the diabetic retinopathy, that is proliferative diabetic retinopathy, PDR. Now, this is the stage from at this point the proliferation of the vessels have become to increase, and soon the VEGF and its whole mechanism will also be involved, because VEGF is the only stimulus chemical that is the culprit of this proliferation of the vessels. So in just one picture, trying to summarize the whole proliferative diabetic retinopathy, you can see that the new vessels are the formation of the new vessels can be seen. Cotton wool spots, highly critical point can be seen here, dilated veins and hard exudate. But the thing here to be noted is that the new vessels are also further categorized if they are at the optic disc or within one disc parameter, they are known as NVD, new vascularization at the disc. But if they are far away, like here, they are known as new vascularization elsewhere, away from the optic disc. From here picture you can know that even further categorization of the new vascularization we have done in order to point out that whether the formation of the vessels are at the point of the optic disc or are they away from the optic disc. Fourth, this is one of the severe and clinical point of the conventional classification of diabetic retinopathy, diabetic maculopathy. And why I said that it's a kind of severe, I am going to tell now. It is the most common cause of the vision loss and the blindness in diabetes, and it occurs at any stage of the diabetic retinopathy. It does not, you cannot characterize it that it's going to come at the very severe point or at very initial point. It can occur at any stage of the diabetic retinopathy. And trying to define it also for your quick vision, that it is a kind of retinal thickening caused by the accumulation of the intraretinal fluid. But where does the accumulation of the intraretinal fluid occur? That is the critical point, because you know that retina has 10 layers. Out of those 10 layers, inner and outer plexiform layers are primarily the location point where the accumulation of the intraretinal fluid takes place. And due to this thing, the retinal thickening is seen, and this retinal thickening is characterized as the diabetic maculopathy, and it occurs due to the hyperpermeability of the retinal vasculature. And even further, we are categorizing it into 3 more types for further understanding the scenario: focal maculopathy, diffuse maculopathy, and ischemic maculopathy. Focal maculopathy you can know by the point that it is kind of localized and diffuse has been diffused, but the ischemic maculopathy is the one which needs a quick understanding, because the macula is may look completely normal in ischemic maculopathy, but there is still marked vision loss complained by the patient. And why does that occur? It occurs due to the microvascular blockage. So this is the thing which I am trying to highlight here, that in the ischemic maculopathy, the macula is trying to be seen as normal, but it is not, and the patient is still complaining that he is having marked vision loss. And why he has marked vision loss? Because it is due to the microvascular blockage that has been occurring inside the eye. Again, from your same book, Focal Macular Edema, I have tried to highlight the same points here, that the capillary segments here, if they leak out the lipids and proteins, a shiny spot with sharp edges are seen, that is characterized as hard exudates. Don't try to confuse hard exudates with soft exudates, they are both different pictures. And if the same capillary segments, capillary burst and leaks blood, dot clot hemorrhages are seen. And this is specific focal macular edema which I am trying to show here. Second is the diffuse macular edema. In this, again, exudates involving the whole macula can be seen along with the hemorrhages. And now we are coming to the 5th stage, at the advanced diabetic retinopathy, also known as the ADR. In this kind of severe form, that fractional retinal detachment is kind of occurring. And again, I am trying to highlight one point, that neovascularization of the iris can also lead to the neovascular glaucoma, rubeus iridis, because these new vessels, when they go to the drainage angle, they block them, and secondary glaucoma, known as the neovascular glaucoma, takes place. So this is also one of the high clinical point that needs to be addressed along with the classification of the conventional diabetic retinopathy. 6th, the last stage, the birth of diabetic retinopathy. This is the end stage of proliferative diabetic retinopathy. In this stage, the vascular component has regressed drastically and the fibrous component is left behind. Now, kind of 2 main categories, if you can summarize it, that there is one category known as the non-proliferative diabetic retinopathy, which you have already known by now. This is known as the early stage. Vessels are weakened and weak, and no new abnormal blood vessels are seen. Second is the proliferative diabetic retinopathy. This is one of the advanced stage in which the retina grows abnormal and fragile vessels, and the VEGF is the main culprit involved in the proliferation of the vessels in the proliferative diabetic retinopathy. not in the non-proliferative diabetic retinopathy. This is a clinical picture which I have attached, so you can know that how does the patient of the diabetic retinopathy see. The normal vision is clear, but the vision of the critically patient of the diabetic retinopathy is highly altered. Now summarizing the key points, we have stated that the stages start from even the person is diabetic, but in the very first initial stage he has no retinopathy. Then the stage 1 tries to set in, then stage 2, then stage 3, then proliferation stage sets in, and then the proliferation of the stage is set in. Second point, non-proliferation diabetic retinopathy is the early, and proliferative diabetic retinopathy is the advanced stage. And the third point is that diabetic maculopathy can occur at any stage, and it is a severe form, and early detection prevents the blindness, and control of sugar, BP and cholesterol is highly recommended in these type of patients.